Hey, Rachel.
Hi.
Hi, everyone. Welcome to our special back to school edition of Ask the Doctor. The Cook County Department of Public Health holds these Ask the Doctor events at least once a month in both English and Spanish to allow residents to ask their questions about COVID, vaccines, masking, any other questions the community might have. We will be holding a Spanish language Ask the Doctor tomorrow at 7 p.m. Today, just to remind you, is a back to school themed event. So we're mostly going to focus on questions around children, schools, and families. If you have any questions, please ask them in the comments on Facebook or on YouTube. I am Dr. Darcie Moeller. I'm the COVID-19 Health Equity Lead at the Cook County Department of Public Health. And we are honored to welcome today Dr. Rachel Rubin, the Senior Medical Officer and Co-Lead of our Health Department. Also with us is Palak Panchal. She's an epidemiologist with CCDPH, and she's going to be able to help us answer questions specifically around data, trends, things like that. And just to remind you guys, this event's being recorded and will be kept on both Facebook and YouTube, so you can come back, watch it again, refer your friends, neighbors, or parents, whatnot, to come and check it out. With that, I'd like to turn it over to Dr. Rubin for a little bit of an opening statement. Welcome, Dr. Rubin.
Thank you so much, Darcie and Palak, and happy to be on this panel today. We know that parents are especially concerned about what this means in getting their children back to school, and we want to do this safely and we want to minimize the transmission of the SARS-CoV-2 virus resulting in COVID-19 infections in our children and our faculty and staff in schools. So there's been a variety of new guidance put in place regarding schools. The most important is that we are asking that there's universal masking. In fact, we're not asking, it's been mandated by the state, that there's universal masking of all staff, all faculty, all students, regardless of their vaccination status. And the reason this needs to happen is because you can be asymptomatic and even having been vaccinated, and you can transmit the virus to somebody who is susceptible, meaning somebody who hasn't been vaccinated. We do know that most people that are vaccinated get very mild cases of the disease. And the more that the virus is circulating in our communities, and right now we are at high transmission throughout the entire state, every single jurisdiction. So what this means is that there's a lot of vaccination floating around there, which means that we're going to see more cases amongst the people that are unvaccinated, especially, and also at a much lower percentage, but still happening, breakthrough cases, meaning those that have been vaccinated getting generally milder forms of the disease. We don't want any of this to happen. And the best way to do that is to vaccinate anybody that is eligible to be vaccinated, and for everybody to be wearing masks, whether you're vaccinated or not, at least until we can reevaluate the situation once levels of the virus have decreased from this very high level. Once the levels of vaccine transmission have gone down to a low level of transmission, then maybe we can rethink some of these needed masking, especially for those that have been vaccinated. But we can't do that until everybody that's eligible, or almost everybody that's eligible, has been vaccinated.
Thank you, Dr. Rubin. I'll read out this question in just one moment. Palak, do you have anything that you'd like to say before we get started?
Nothing more to add that Dr. Rubin hasn't. I just want to introduce myself. I'm the program manager for Vaccine Preventable Disease Program at CCDPH, and I'm happy to be here to answer any questions concerning school-related COVID questions.
Thank you, Palak. Okay, I did see a question there for a second from Joanne D'Angelo. Should I be worried about music venue next week? They want proof of vax or a test. I can take this one, and I'm sure that my colleagues could expand on it. If it's an outdoor music venue, you're going to have a lower risk. If it's indoor, then certainly, we wouldn't recommend big crowds at this time, but certainly wear your mask. And I think it also depends on your vaccination status. So, we all have to make our own decisions for what's right for us as far as our own personal safety. But we also have to think about the people around us. So, right now we're recommending anybody who's indoors is wearing a mask. I guess we're mandating that actually everybody's wearing a mask indoors. Taking steps to keep everybody safe would include keeping social distance from people, at least 6 feet if possible. Outside would definitely be better than inside. And it's great that the music venue is requiring testing or vaccine, but we still want to follow these measures because, as Dr. Rubin pointed out earlier, it's still possible to contract and transmit COVID with vaccine. There's also, unfortunately, some people who are misrepresenting their vaccination status. So it's good to be careful. Anything to add, Dr. Rubin?
I think you said it. Thank you.
So our next question is from Kristen Nicole. She's asking, please explain the difference in DNA and mRNA. Oh, this is a good basic science question. I love this. Dr. Rubin, you want to take it?
Sure. Well, DNA, I'm trying to figure out how to do this for sort of a general audience and having to bring back the knowledge of genetics. DNA is basically the basic genetic material in the body, and it's made up of a double strand. If you separate out those strands into a separate strand, that's how it replicates. And the way it replicates is there's a strand that's a single strand, which is called RNA, that binds to that DNA, and that's how we can sort of replicate the DNA and the genetic materials can get in all of our cells. So what the M stands for in mRNA, M stands for messenger RNA. There's different kinds of RNA because they serve different purposes in the reproductive process of DNA, or I guess you could say reproductive process of DNA. So the vaccine in particular, where this comes in, is there's messenger RNA from the virus that is used to make the vaccine, because the virus itself, see, viruses have, usually they don't have DNA, usually they just have RNA in them, and our body has DNA and RNA. But the important thing is these viruses attack our own genetic material in our body. So that's why it's important to know this. But the way the vaccine was manufactured was by using the messenger RNA, this particular kind of RNA in the coronavirus, to then make a vaccine. But the virus is not in the vaccine, nor is this genetic material. This genetic material, which comes from the virus, which allows the virus to replicate, is only used to manufacture the vaccine, but it is not actually in the final product of the vaccine. So maybe I'll leave it at that.
Yeah. This gets real deep. It gets real deep. I'm assuming they were wondering, because of, people have concerns about how the vaccine was made and how it interacts with our own genetic material. And I think that's a great summary. Essentially, the mRNA is kind of like a recipe to make something, and the vaccine is based off of a recipe from the virus, not actually replicating of the virus itself. Okay, question for Rhonda Thomas. Most schools have kids eating indoors with very little distancing. What is your recommendation to keep students safe during the indoor unmasked time? So that's a very good question. I'm going to give this to Palak.
Normally, we have been, we highly recommend schools to keep students at 6 feet of distance during lunchtime or stagger lunch times. That way, children, while they can remain unmasked and can also eat their lunch. And if with schools having, more and more schools having the testing program of Shield, or even having Buy Next Now test, we can catch the asymptomatic or pre-symptomatic students who, we can catch them before they become infectious and can pose a risk to the rest of the school community.
Wonderful, thank you. I will say too, just to add, it's still nice outside. If you could convince people to move lunchtime outside, that would help a lot as well. That would go a long way. Okay, next question. I have a question about virus mutations. How vaccination is going to protect you from a new mutated virus? This is another really difficult, a very intelligent question, because it's hard to sort of explain the basic science around it. But essentially, when viruses mutate, they certain different parts of them can change. The mutation isn't always the same type of mutation. So essentially, since the vaccine is targeting, the current version of the virus, whether or not it's going to be effective is going to depend on how sort of big or how changed the virus is. I know that's probably not maybe detailed enough to help you understand. Rachel, Rubin, do you have anything to add to kind of explain how vaccination can still protect us from some mutations?
Well, yeah. I mean, the only other thing I might add, and you've said this well, is that, the vaccination is designed in a way to cover for multiple components of the vaccine, different proteins that the vaccine produces. And with a mutation, not all of the pieces of that virus or the vaccine are affected. The virus only changes maybe in a small way. So the current vaccine will cover for at least the first several mutations that occur. The more mutations that occur over time, and this could be over months or years, that eventually the original vaccine will become less and less effective. But right now, with the number of mutations that we've seen, which have been maybe 5 or 6, which might seem like a lot, but it's really not, the basic vaccine still covers for the vast majority of the virus genetic materials. So therefore, the vaccine continues to work very well, even with the Delta virus. But with the Delta virus, it doesn't work quite as well as with people that just got the virus from the Alpha variant or the wild type variant, which was the very original one over a year ago. So eventually, we do need vaccines to be slightly redesigned. Doesn't mean a lot, but just a little bit to take into account those new mutations. And there is a vaccine in the works. I don't know when it'll be ready, maybe by the end of the year, that is geared towards the Delta vaccine, because we know that Delta is so much more contagious. You can get it much quicker and much more easily. So we definitely want a vaccine eventually that will target the Delta, because it's easier to get Delta as it's floating around. But it's just like the flu vaccine each year. Your prior year vaccine will cover you a little bit for this year, but the flu vaccine is one of those viruses, or the flu virus, the influenza virus, changes really quickly, but it changes in a predictable way, so that each year when a vaccine is made, we can predict, not 100%, but to a fairly high degree of accuracy, we can predict what kind of mutations are going to happen, so then we can design the vaccine against those new mutations. And it's never perfect. That's why there's a fair amount of breakthrough cases with flu. But just like with COVID, if you get a breakthrough case of flu, meaning you get influenza after you've had the vaccine, it tends to be much milder. So it's the same thing with the COVID vaccine.
Thank you, Dr. Rubin. Okay, so our next question, should we be seeing our young grandchildren who cannot yet be vaccinated? That's a very difficult question. So I think this comes down to your risk tolerance and basically what you are sort of accepting, and then also how, what kind of health conditions you or your young grandchildren may have. So I think when you ask this question, there's two ways to look at it. There's thinking about your own risk. So what risk does your grandchild who has not been vaccinated pose to you and your health? And then what risk do you pose to their health? So for instance, if you are vaccinated, are you posing a risk to them since they have not been vaccinated? So it's complex. I think the simple answer is you want to do all of the techniques that you're able to do to keep them safe and to keep you safe. That might include, if they're young and they're not in school and they don't have any exposures, that might include forming a little bit of a pod. So that is that you could interact with them, but maybe with this understanding that you aren't doing a lot of interaction outside of your small family circle. Wearing masks, social distancing, meeting up outside. All of these things can kind of change depending on, for instance, if you are at really high risk of severe illness from COVID, or your grandchild is, you might let that determine your behaviors a little bit. So I think, unfortunately, it's not an easy cut and dry answer. But certainly you could see them in safe ways, being outside, being with masks, being distanced, those types of things. And then, if you would like to be closer and be in the same house and even be unmasked, I think it's going to depend a bit on what other things you guys have going on in your lives. What are think about your other exposures. Palak, do you have anything to add to that?
I think you said it succinctly, Darcie. Yes, and if you want to be extra precautious, what you could do is, if you don't see your grandchildren often, you could, have the either the grandchildren tested if they are old enough to be tested, or you could on both ends. Self-quarantine or self-isolate for a few days before you meet. And that way, if there are any symptoms or if you are possibly infectious and it may show up, remember the incubation period of the COVID virus is 2 to 14 days. So during that time period, a person may develop symptoms and a person may remain asymptomatic up to 12th day and may also develop symptoms on 13th or 14th. So given that Delta is so transmissible and 99% of the new cases we are seeing are from Delta, it's it would be a good practice to have these layered strategies to prevent and control.
Yes, thank you. Okay, our next question is, what is the latest about receiving a COVID booster shot? Very popular question. I'm going to give this to Dr. Rubin.
Yeah, well, the latest is we're sort of status quo. President Biden announced that booster shots would be available to anybody who had a vaccine 8 months ago or longer, which predominantly means our frontline healthcare workers and public health workers and our long-term care, like nursing home and assisted living residents, because we are the ones that were vaccinated last December and January. So now it's the 8-month period. And that was from President Biden. However, both the FDA, the Federal Drug Administration, and the Centers for Disease Control and Prevention need to review that guidance, that suggestion, and look at the medical literature. And in fact, they're meeting the ACIP, which is the Conference on Immunization Practices that works with the CDC to determine guidance that the FDA then considers for approval for these uses of vaccine. They're actually meeting today to discuss booster. And we have to see what they say and what they recommend and vote on in terms of whether boosters are really necessary at this point for the general population that would start on September 20th and maybe start with those of us that are healthcare workers and then work our way through the rest of the population. We do know that probably boosters will be needed eventually, but we've been seeing that even though we're seeing more breakthrough cases, that's also because we're seeing a lot more COVID out there. And that's basically related to people not being vaccinated, and not just in our country, worldwide. We really need to get vaccination into everybody's arms throughout the entire world, not just our own country or even our own continent. Because, travel is there, and, we live in a very small world in some ways in terms of contact between individuals. So we really need to get that done. And the boosters have been shown that even 8 months out, they are still highly effective against the Delta virus. And remember, vaccines are not really designed to prevent the disease 100%. They are designed to prevent severe illness and potentially death. And our vaccines have done that. In fact, they've done this for the COVID vaccine remarkably well. In fact, the technology that we're using with these mRNA vaccines, as well as the other technologies, have worked tremendously well. In fact, even better than what we have seen for flu vaccines on a yearly basis. And so the vaccines continue to work extremely well, even without boosters. But let's see what the CDC and the FDA are doing, and they're discussing things today, and then we will get somewhat of an answer over the next few weeks.
Thanks, Dr. Rubin. Okay, I got the second dose of the Pfizer vaccine and felt good the first day. I then started getting a headache, nausea, and sore arm. But last night I was so hungry and never felt full. Is this normal? Well, okay, so first I'm going to say that, we aren't your physicians. So if you're concerned, absolutely please talk to your own physician. But you're bringing up a good point. Are you having side effects from the vaccine? So many people have side effects. The side effects, the way we could describe these side effects, I think sore arm is, the most common. The second most common are these sort of what they call flu-like symptoms. So it can be headache, body aches, things like that, a low-grade fever. I will say that though these are common, it's a sign that the vaccine is working. So the way that the vaccine works is by triggering your own immune system to start fighting. And that's so that it's ready to fight when it sees the real virus. And when you feel sick, it's actually because your immune system is activated. It's not because of whatever you're sick with. So this immune system activation is what can make you feel these symptoms. So I will say there are side effects. Many of these side effects that you're noting here are very normal, but if you have concerns, please check in with your personal doctor, because certain things can depend on your own personal medical history. Okay. Convalescents versus vaccinated are both considered fine for regular donating blood or bone marrow. Dr. Rubin?
I'm not. I'm going to try to interpret the question. I'm not 100% sure I understand. If somebody has been treated with convalescent blood, basically,
or maybe they're saying if somebody had COVID and recovered, is that okay to donate blood versus someone who was vaccinated?
Yeah, yes. In either case, it is. Yeah. Oh, it says regular donating of blood and bone marrow. Yes. If you have completely recovered from COVID, or you've been vaccinated from COVID, you may please give blood. And it's really important to give blood. I really support blood donation. So if you're willing and able to donate blood, I would say if you've had COVID, wait until you're fully recovered. Maybe even give it an extra bit of time after that. Go ahead and go ahead and give blood. Certainly, if you've been vaccinated, you may donate blood and bone marrow.
Thanks for the question and for considering donating. Okay, can you talk about MissC and how it relates to COVID? So this is the multi-system inflammatory syndrome that we see in some children, unfortunately. I'm also going to defer that to Dr. Rubin.
Even though you are the pediatrician. Yeah, so this multi-system inflammatory reaction to COVID in some children, we don't really know why. It's what we call an idiosyncratic reaction. In other words, we cannot predict what children might get this reaction. And it's not unlike similar type reactions that we have seen from other vaccines. They are very rare, but indeed can create very serious disease. I think the important thing is that and we know this, the pediatricians are, and family physicians and emergency room doctors, et cetera, are certainly well-versed now in looking for this complication. So if somebody comes in with symptoms, a child consistent with this condition, that they certainly ask about vaccination status and about COVID status. I'm sorry, not vaccination, about their COVID status. And either get a COVID test or get a history of seeing whether they had COVID. Yeah, so it's something to not be overly concerned about because it's extremely rare.
Yeah, quick clarification. I think at one point you misspoke and said vaccines cause this, but you're correct. No, it's okay. I just want to make sure everybody. Yeah, so it's COVID. We know of viruses that can cause this disease. Vaccination has not caused We have no. That would cause
there have been no severe complications from the vaccines documented to date, other than allergic reactions, which occasionally happen.
Thank you. Okay, so here's lots of people with some science questions. So this is good. And isn't your body supposed to develop more antibodies from real virus rather than from vaccine? If so, then why are people who had COVID still advised and even required to undergo vaccination? So that's a great question. So how much antibody people develop to the real virus versus the vaccine is not consistent from person to person from the studies that we've seen. So in other words, I could get COVID and Dr. Rubin could get COVID, and both of us develop a different amount of antibodies. Likewise, there's not really any way to predict who's going to. Now, we do sometimes know that if somebody has, there are certain conditions that make people less likely to produce enough antibodies. So certainly as you get older and older, you usually produce less antibodies. Also, certain people who are on certain medications will produce less antibodies, but there isn't a predictable way. So we have a lot more data on how people, what we call, develop an immune response to the vaccine than we do to COVID infection. So though we do know that having been infected with COVID provides some protection, we don't really know how much protection, how long that lasts. And we know that there's no reason not to get vaccinated. It wouldn't be dangerous to have vaccination on top of that. And since we can predict the kind of protection that vaccines give you, that's why we recommend, even if you had COVID, get the vaccine. We'll have a better idea for how long that vaccine is going to be effective. Anything to add, Palak or Dr. Rubin? Okay. Okay, we got another question. Are we seeing an increased number of deaths in small children under 12 due to COVID, or does that continue to be very low? I think this is a good question for you, Palak.
We are not, we definitely have been seeing not high numbers of deaths among children with due to COVID, and if there are, then it's we have, from the small number from the studies that have shown, it's with children with who are immunocompromised due to other conditions. However, with the in terms of the case numbers, we are, because the schools have reopened, we are seeing a high number of cases, obviously more among the high school kids, and all the other age groups tend to follow the same trends as the high schoolers. But that's, no, we haven't seen. And we hope we keep it that way.
Yes, yes. Very grateful for that. What are some extra precautions we can do over Labor Day weekend to remain safe? Great question. I think we all could answer this probably. I'll give my recommendations. We can go around the room. So I know it's all the same stuff and it feels like a broken record, but the weather's beautiful. So go outside, be outside. If you want to see people, see them outside. I think that's the number one best thing that you can do. Who else? Palak?
Well, I do know that a lot of people will be flying as well to see their family members as people are getting vaccinated more. So please follow CDC recommendations of getting tested in the last 3 days before your travel. And then during your destination, wherever you are, please continue to wear masks, social distance, avoid crowded spaces, even indoors as well as outdoors. If you're outdoors, wear mask if you're in a crowded place. And then after you come back from your trip, we again recommend for you to get tested and then monitor your symptoms. And if you do have symptoms, right away isolate yourself, and and if you haven't been tested, then test.
Dr. Rubin, anything to add? Any other things you'd like to tell people about their Labor Day weekend plans?
I would suggest not having Labor Day punches inside. Get carry out and eat in the park and have a good time outside, as you already said.
Yeah, that sounds nice. Yeah. Oh, there's another good question. When will the vaccines be available for kids under 12? I think the short answer is that we don't know, but Dr. Rubin, do you have any more insight into possibilities?
No, I really don't. We're hoping sometime this fall. Again, there are studies underway with both Pfizer and Moderna with younger children, and they have to have enrolled and observed a certain number of individuals before the CDC and the FDA in particular will then consider approval for expansion to younger age groups. And I don't really know the status of those studies at this point, other than they are ongoing. And all I can do is say the sooner the better.
I know I'm excited. I have a 5-year-old son. I'm looking forward to getting him vaccinated so that we could do some of the things we've been putting off. Someone is looking for the science behind the masks. So there is a lot of science. So there's a lot of evidence that masks work, that they decrease transmission. What we know is that COVID, like many other respiratory viruses that primarily live in our lungs and thrive in our lungs, are transmitted through respiratory droplets. So people think, say it, don't spray it droplets, but whenever we're talking, there's actually fine particles of droplets just that are in the air. When you breathe, we actually lose water from the act of breathing. And so these droplets are in the air, this sort of mist. You can picture this fine mist that's around us as we speak and breathe around each other. So that is the primary way that COVID-19 is transmitted. We do know, people talk about washing our hands. That's very important. We do know that it's possible for it to be transmitted by touching a contaminated surface and touching your eye or your mouth, but not as common. The most common is this respiration. So basically what the mask does, it creates a physical barrier. You can really just picture it, kind of imagine in your head, when I said to say it, don't spray it, someone who's kind of spits when they talk, right? Just picture that mask just blocks it. and from both directions. So it's both protecting, the science focuses more on that you're protecting from droplets landing on your own face, but you're also creating a barrier between you and the people around you. If you really want to get into the hard science, there are some great studies that we could direct you to. Maybe we'll put some on our website so that people can see the direct studies that they've done that actually measure how much virus you can is in the sort of the air particulates within certain distances of people who have COVID-19. Okay, here's another question. If someone tests positive in your home and you have been fully vaccinated, do you recommend the 14-day quarantine for the vaccinated person? Good question. I think I'll give this to Palak.
If you're fully vaccinated, you do not need to quarantine. However, we do recommend that 3 to 5 days after your last exposure with somebody in your home to get tested. However, if there's ongoing contact, let's suppose the person in your household isn't able to isolate himself or herself and there's ongoing contact, then it's best that that the vaccinated person monitor their symptoms until the person who's positive finishes 10-day isolation. And then on the 10th day is your day 0. Then you count 3 to 5 days after the positive person's 10-day isolation ends, and you can get tested to check whether, if you have the virus or not. But throughout the whole 14 days of your household member's 10-day isolation ends, continue to monitor your symptoms.
Yes, thank you. I think that's the important piece there too, right? So the big thing is, even though you're not quarantining, you are paying attention to if you have any symptoms and preferably getting tested as well, because we know that it's possible to carry the virus even if you've been vaccinated, though it is protecting you from severe illness. Okay, next question. Why did the FDA only approve the Pfizer vaccine for 16 plus? My 12-year-old wants to get vaccinated, but this decision gives me pause. Oh, that's a very good question. I'm actually, Dr. Rubin, if you don't mind addressing that about the FDA approval.
I think it's because Pfizer was the first manufacturer pharmaceutical to have sufficient studies completed and in place in younger individuals for the CDC and FDA to consider approval for that age group. And we're hoping that Moderna is coming shortly. And I don't really know about the J&J at this point either. And so at this point, only Pfizer has been recommended, but we hope that the others will be coming along.
Oh, got a few different ones popping up here. Okay, let's see. Do you recommend certain masks to use, or does any type work good enough? That's a great question. So, in hospitals, many times they are, if you're going into a medical visit, they'll a lot of times require that you wear what they call a surgical mask. They're the ones that have, a lot of times they're blue or white. There are studies that show that surgical masks are better than most cloth masks. And unfortunately, we don't have great sort of scientific data on one cloth mask to another cloth mask. I'll tell you what I do when I'm out in public. I go to the grocery store, whatnot. I wear my cloth mask. But if I'm going somewhere where I'm going to be close to people, and especially if I'm going into a hospital environment, because that's where a lot of people are sick or vulnerable, then I will wear a surgical mask. But they should be providing that to you. Schools also have, I know many of them have their own sort of stock of surgical masks. So if you have a choice, the surgical mask is a great way to go. But cloth masks do offer good protection and is certainly better than nothing. And then even though it wasn't in your question, I will say N95s are the sort of the ultimate standard, but the only people who really need to be wearing those are the people who are working in inpatient hospitals and things like that.
Can I also add, the N95 masks, they do need to be fitted for the person. So if you're not fit tested for N95 mask, and you wear in public, then it will just act the same as any other surgical mask. Of course, better than cloth mask in terms of barrier. However, it's best if you wear surgical mask. If you want to be double protected, you can wear surgical mask and a cloth mask over it if you're in a crowded situation.
Yeah, great advice. Thank you, Palak. Someone's asking about how long the germs sit on our masks. And I don't know if I know the latest research. I remember they do, COVID survives much longer on hard surfaces. So do either of you guys know the actual answer of how long? I know we do. I will say we take the precautions, and you must have heard this because you're asking this question, that you pretend like the outside of your mask is covering COVID. So you sort of think that so that you don't touch it because you could contaminate your hands. So when you take your mask off, you take it off by the loops. And if it's a reusable one, throw it in the wash. If it's a surgical one, throw it in the garbage. So that's a good practice. But the actual amount of time that it can survive on cloth, all I can say from my medical knowledge is probably not very long. So I don't think it's one of those things that, like, a lot of people are probably not getting COVID from taking their masks off the wrong way. It's just a precaution. But I don't know if there are sort of latest studies in that area. Anything to add, Palak or Dr. Rubin?
I think, sorry.
No, please go ahead. No,
I was thinking, without having any data on hand, it should have, we can look at masks at the same way as fomite transmission. I mean, on inanimate objects where you touch and then, but that's why we are always recommending sanitize your hands. And then after 2 or 3 times of sanitizing, if you can, wash your hands with soap and water so you can remove all the gunk from your hands. But again, Darcie, pulling your mask out from the ear, the elastic parts is the best practice.
Yeah, no, and I agree completely. And obviously, don't show your mask.
Right.
And replace your masks, especially if it's a surgical mask. At least replace them once a day, and wash the cloth masks. And obviously, don't share them.
Yeah. Someone's asking if they can reuse their N95, and that's a great question. So early in the pandemic, we didn't have enough N95s, as I think we all know. So we did reuse them frequently. And so I do think there's been a bit of a precedent set that they can be reused. You have to be a little bit more careful because, again, you want to imagine that the outside is contaminated. So if you have one at home and you'd like to use it at least a few times because they can be expensive, you want to look up on, I think the CDC has some good pictures of how you want to put it on and take it off, and then how you want to store it. Because basically you have this N95 that presumably you're using because you've been around someone with potentially you're taking care of someone at home with COVID, so you're wearing one. So you want to imagine that it's contaminated, and so that the way you take it off and then the way you put it back on is going to be a little bit more important if you're reusing it. And then I will say, storing it, they say hanging it or putting it in a paper bag is the best practice. Of course, the lowest risk would be to throw it away. But I do think, they're expensive, and if you want to use it a few times and it's not soiled or wet, then you absolutely could do that. Okay, what is your advice for students participating in sports, indoors and outdoors, in terms of masking and other prevention measures? This is a very good question, and there's been a lot of questions around this. I'm going to defer to Palak on this, our school expert.
Yes, for outdoors, CDC recommends that if it's low contact sports, you don't have to wear mask. In general, outdoors, if you're not considered close contact, if you do come in contact with a COVID case. However, there are high risk sports such as football or others, basketball, where you may come in contact. So in that, I defer to schools how they want to be strict about it, but generally outside you are okay without mask. Indoors, definitely masking. We recommend masking indoors for all. sports.
Thank you, Palak. Okay, I rotate my daughter's mask for school every day and promptly wash them in the laundry. Great. Is this the best practice, or do you have others? That's exactly what I do. So my son is just started kindergarten today, actually, and we have enough masks that he could wear a new one every day. I actually have a little bin at the front door, like a little mini hamper, and so he only wears them once. I would recommend to wash them in hot water. Some people like to double wash them. I don't know that there's evidence that it needs to be double washed. Now I'm seeing Palak shake her head. But I've heard that some people like to do that. So yeah, you're doing it just right. That's great.
I mean, you can use, if you don't have colored mask, you can use like diluted bleach water as well.
Great. So I do see someone mentioning here carbon monoxide from wearing it too long. So this is a common misconception. So there's no evidence. Actually, why don't I pass this to Dr. Rubin? You could talk about this.
In fact, there was a recent study or sort of experiment done to actually measure the carbon monoxide behind wearing a mask. And there is minimal to no increase in carbon monoxide measured behind the mask. I mean, the masks are loose fitting. And they are permeable to the air. You are breathing through them. You are not wearing some closed respirator that requires outdoor air to like circulate through a valve or through a filter. This is not that way. This is a cloth mask or surgical mask that are relatively loose fitting. Even the N95s allow enough air exchange that you are not going to get a buildup of carbon monoxide. It really is a misconception.
Yeah, and I like to mention too, just because I think it gives people this little extra layer of reassurance. Surgeons have been wearing masks for many, 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 many hours for a long time. So when you're in an operating room, everybody wears a mask. That's where surgical masks come from, right? They're called surgical masks because surgeons wear them. And some surgeries go on for 8-10 hours, and they've been wearing those, and so we have a long precedent, a long history of showing that wearing masks all day can be safe.
I also wanted to add a little bit the difference between the N95 masks and the surgical mask, which, surgical masks are the source protect. They act as a source control, meaning if you have COVID and you're wearing a surgical mask, you protect others. Because as Darcie mentioned, when we talk, there are droplets that they're invisible droplets so that are suspended in the air anytime you cough, sneeze, laugh, or talk. So wearing a surgical mask is more of a protection to other people from your droplets, but then it also provides a barrier from other persons to you. N95 is you protect yourself from other persons' droplets, and that's why it's very important that you be fit tested for N95. Otherwise, I don't see any reason buying an expensive mask if you can wear surgical mask and double protect with a cloth if you need to.
That's a really good delineation. Thank you, Palak. So the surgical mask is more, like you said, the source control is helping to not infect others, though it does probably provide some protection, right, from the larger droplets and whatnot in the air, but it's not considered. That's why if you're taking care of someone with COVID, that's why a properly fit N95 is recommended, because it actually will prevent the virus from getting through. Okay, so this question we have up here, question about outdoor activities or sports. So the airborne virus during humid days, do the droplets stay in the air longer? That's a great question. I actually have no idea. Do either of you? I mean, I wonder if there's any studies on this. I don't know. I haven't seen.
There probably are. I mean, there probably are, especially within, occupational health settings, that there probably is literature looking at this, because there's a lot of work being done about, airborne transmission. And humidity certainly would affect it. But we do know that being outside, regardless of the humidity, your risk of getting COVID is much, much lower than if you're indoors, and if it's drier indoors and more humid outdoors.
Thank you. Okay. With the fall season coming upon us and seasonal allergies, oh yes, how do we communicate with the school that our child does not have COVID but has seasonal allergies without having them to get tested for COVID every time they attend school with symptoms that fall under seasonal allergies and COVID? That is a great question. So I hear your pain because I have very bad seasonal allergies, as does my son. I don't know that I have a good solution. I do think that until we're all able to be vaccinated, frequent testing is really the way that we're all going to be able to stay in school. And I do know, because I've done some contact tracing myself, that there are many people who have allergies who also have gotten COVID. So sometimes we think we have, obviously our allergies, but then it isn't. So as their parent, I know that's got to be incredibly frustrating. So I want to sort of say I understand where you're coming from, but then I also think we do frequently probably have to check people more if they're having symptoms, allergic symptoms, because we have to make ourselves feel good that yes, in fact, that's what these are. I will tell you that with schools, this is our big concern right now because everybody's in these smaller classrooms, and this is where we're seeing numbers go up, is in kids who are in smaller classrooms. So be patient, and I hear you, but the more testing you get, probably the safer your child's going to be that way anyway. So anything to add, Palak or Dr. Rubin?
I get this question a lot from the schools. I mean, there again, this schools do follow the guidance. For the majority of the schools are following our public health guidance. Having the testing and screening program helps. If a child does have allergies, we do recommend that, of course, keep your child stay at home if it's very severe allergy in terms of coughing, because even COVID or not COVID, you should not be sending your child to school with severe cough or respiratory illness. And of course, stay home 24 hours fever-free before coming back to school. And we also recommend that to get a doctor's note where there is, where the doctor does a clinical assessment, says there is no suspicion of COVID, and provides an alternative diagnosis of seasonal allergies. And then with continuing screening program at school, wearing masks and social distancing, those are good strategies. Layered all together should protect your child and others.
Thank you, Palak. Do you want to note that we're getting close on time here? We've still got plenty of time, but we're probably going to get down to our last couple questions and then take some final statements. Okay. So what's the recommendations for a booster? Oh, so we did address this a little bit earlier. It says, I personally know fully vaccinated got COVID. Yeah. So we do know that there are what we call breakthrough cases of COVID. I do want to put in a little plug. That doesn't mean you shouldn't get vaccinated or that it's not worth it, because it's preventing you from getting severely ill and it's preventing deaths. So the booster recommendation, Dr. Rubin mentioned earlier, we don't know yet. What is it? The American Collaborative for Immunization Practices, is that right? ACIP. They are meeting today and are going to be discussing whether everybody should get boosters. Right now, boosters, I believe, are only approved for people with who have severe immunocompromised conditions. Other than that, I would just hold on and wait. If I'm pregnant or breastfeeding, should I get vaccinated? Great question. This is one we get frequently. Always with pregnant women, we like to defer to OB or to your primary care to discuss further. But I will say that as a general rule, vaccination is beneficial for pregnant women and certainly for breastfeeding women. Discuss it with your personal provider, but from a public health standpoint, if you're at regular risk otherwise and don't have any other conditions, it would be safe and beneficial for both you and your baby. Okay, are the immunocompromised able to get a third dose? Dr. Rubin, can you take this one?
Absolutely. People that are immune compromised can get a third dose right now. You can go anywhere, retail pharmacy, speak with your own doctor. But the important thing is to talk to your doctor first to see whether your immune compromised condition really means that you're immune compromised in terms of not being able to mount the right kind of immune antibody response to COVID. Not all immune compromise is the same. For example, people that are diabetic think that they're immune compromised, but not really. They're not immune compromised to the extent that they would need a booster at this time. The people that are included in this category are those that have certain kinds of cancers, especially cancers of the blood or of the lymph nodes, which are called leukemias or lymphomas. People that are on certain kinds of chemotherapy, people that are transplant recipients, who've got a kidney transplant, for example, and those that are on certain immune modulating medications to control their underlying chronic conditions, like some medications that are used for rheumatoid arthritis or systemic lupus or multiple sclerosis, because you're on certain medications that suppress your body's response to making antibodies from a vaccine. So these are the main categories right now. However, you don't need to have proof. You just need to attest to it at the pharmacy or where you get the vaccine to say that you have one of these conditions. The main recommendation is talk to your doctor about this first and see what they say about recommending you for the booster. If they say, yes, it's necessary for you now, then go on in and get it.
Thank you, Dr. Rubin. I actually think we should stop taking questions just then. Let's see if this last one, confused vaccine, good for fetus, but not for kids under 12. Oh, yes, it's quite complicated. So certainly if you're pregnant, talk with your personal physician. You have to make the decision that's right for you. Again, we are hoping that the vaccine is going to be approved for kids under 12. And what we're kind of basing our guidance off of right now is the evidence around all of the vaccines that we already give to our pregnant women and children. But certainly anybody who's pregnant, talk it over with your provider. You have to do what you're comfortable with. Okay, so we're just about out of time, so I want to thank everybody for joining us. I'll ask Dr. Rubin, do you have any closing thoughts for us to leave us on?
If we do the right thing, we wear masks at all times indoors. If we get vaccinated, if we're eligible, once our younger children get eligible, get them vaccinated, we're along the road to recovery. And enjoy the Labor Day weekend by being safe and being outside.
Thank you, Dr. Rubin. And I also want to thank Palak for being here. I really appreciate you guys being here to support me. So again, a Spanish language Ask the Doctor is going to be broadcast here tomorrow at 7 p.m. So please spread the word and watch our social media channels for the latest data, including case numbers, vaccination rates, and any news about COVID-related issues. Thank you all for joining us and enjoy the rest of your day.
Thank you.